If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, which condition is worse, high blood pressure or diabetes, and why? Answer by Angela Punis. Diabetes is a condition in which the amount of glucose, sugar, in your blood is too high because your body cannot use it properly. This happens because your body either cannot use or make a hormone called insulin, which is responsible for turning sugar into food for your body's cells. Video, blood pressure exercises vs LCB. If diabetes is not controlled, it can cause serious damage to your kidneys, eyes, nervous system, heart and blood vessels. Treatment for diabetes aims to avoid this by keeping blood sugar levels as near to normal as possible. Many factors determine your risk for developing diabetes: your age, your ethnicity, or any family history of diabetes, for example. Some of these things you cannot do anything about. However, you can help to lower your risk of diabetes by following a healthy lifestyle, for example, by stopping smoking, by eating a healthy diet and keeping to a healthy weight, and by getting more active. Answer by Manisha Saxena. High blood pressure. These symptoms may mean you have this, so lower down your blood pressure. High blood pressure is defined as high tension in the arteries, which are the vessels that carry blood from the heart to the rest of the body. Anyone whose blood pressure is 140/90ths of a millimeter Hg or more for a sustained period is said to have high blood pressure, or hypertension. People who are determined with high blood pressure should have their blood pressure checked frequently. Even if yours is normal, you should have it checked at least once every 5 years, and more often if you have any contributory factors. If the high blood pressure is not treated or controlled, the excessive pressure on the artery walls can lead to damage of the blood vessels, cardiovascular disease, as well as vital organs. The extent of damage depends on two factors: the severity of the high blood pressure and how long it goes on for untreated. Even though there is no any cause identified for essential high blood pressure, however, there is very strong evidence linking some risk factors to the likelihood of developing the condition. Treatment for high blood pressure depends on several factors, such as severity, associated risks of developing stroke or cardiovascular disease, etc. Answer by Rick Vonderbrink. This is a little bit like asking if it is worse to be shot or to be stabbed. They are both dangerous. The common thing about each of them is it is not the conditions themselves that we worry about, but rather what they can do. When uncontrolled, both diabetes and high blood pressure are huge risk factors for heart attack and stroke. Remember that there are two forms of diabetes, type 1 and type 2. Type 1 diabetes is a different animal, in that if it is not treated, it is rapidly fatal. I assume you are asking about the far more common type 2 diabetes. High blood pressure, hypertension, is more likely to be acutely dangerous. If it gets high enough, it can cause acute damage to the heart and kidneys, and can lead to burst blood vessels in the brain. Out of control blood pressure is more likely to land you in the hospital than out of control type 2 diabetes. Type 2 diabetes is usually not something that causes rapid onset problems, but when not controlled leads to a host of issues with the heart, kidneys, brain, eyes, and nervous systems. My general experience is that hypertension is easier to control than type 2 diabetes, most of the time. Diabetics require more comprehensive lifestyle management than hypertensives do. Also, the great majority of type 2 diabetics also have hypertension, so they get the worst of both worlds as it is.